Hey guys, how are you all? Welcome back to MedSteps YouTube channel. So now we are in first aid series musculoskeletal system. Now we are in episode 6 clavicular fracture. So we also the clavicle bone is also known as collarbone. Okay, if any any break or any disruption of the continuous bone of the clavicle, then we call that is clavicular fracture. Okay, this clavicle fracture is like most common injured bone in the body. Okay, like mostly if you are seeing that this is the bone, you can see here this bone we call clavicle bone. If anything happened in between the disruption of bone, then we call that is fracture. Okay, so here this fracture is this bone we have to understand very important, because if in this is the middle part of the bone at the junction of the distal thirds, this area is very delicate to get fracture. Okay, we have some categories of collarbone fractures. If you are seeing this bone, 80% of injuries we can see in middle part. Okay, in middle and mostly like in distal third part, we will get mostly that clavicular fracture. Okay, this is in lateral end we can see this is 5% of injuries. In medial end we can see 15% of injuries. Okay, so now these fractures will happen. Okay, mostly if athletics events, if patient is like athletes, or patient is fall on an outstretched hand, outstretched arm, or direct blow to the shoulder. Okay, so this like if the patient will be like athlete, okay, or if that patient fall on an outstretched arm or direct blow to the shoulder, then we can see this type of clavicular fracture. Okay, in patients with clavicular fracture, mostly they are presenting with pain and immobility of the affected arm. Okay, and then we can see like the contralateral hand is classically used to support the weight of the affected arm. Okay, if you are seeing this medial fragments, if you are seeing this next image, we can see this medial fragments is going up, because the medial shaft fracture is up. Why? Because here we have one muscle, that muscle we called SCM muscle, that means sternocleidomastoid muscle will pull upward. So we can see like that medial fragment of the clavicle bone, we can see that bone is going to superior and posteriorly we can see. Okay, next in lateral fragments, that means this is the lateral fragments. This lateral fragments we can see it's pulling inferiorly and anteriorly. Which muscle is doing? When it's pulling inferiorly and anteriorly, we can see pectoralis muscle will pull downwards and frontwards. Okay, the weight of the arm of the pectoralis major. All patients with a clavicular fracture should have a careful neurovascular examination to rule out injury to the underlying like maybe some brachial plexus. If you are seeing this image, from this under the clavicle bone, we can see some brachial plexus and subclavian artery and subclavian vein. Okay, that's why always we have to check neurovascular examination. Okay, so I already mentioned that mostly clavicle fracture occurs after trauma, like because of typically a fall, and pain with possible like skin tenting due to fracture and angulation, and you can see proximal fragments will be elevated because of sternocleidomastoid muscle. The distal will be depressed due to muscular like pull inferior and anterior of the pectoralis muscle. There may be accompanying like snapping or clicking. Okay, so if you are seeing the X-ray, you can see this type of image. The clavicle got displaced. Here you can see this image. Okay, this is lateral part and this is medial part. Mostly you can see the middle third of the clavicle. Okay, next for treatment, what are things we can do? We can do some sling if uncomplicated. If the patient fracture will be like open fracture, it's displaced with skin tenting, and surgery is the main important, and always we have to, or neurovascular compromise we have to do. Okay, this is the things for clavicular fracture. If you have any doubts, you can ask me in comment section. Like, share and subscribe. Take care. Bye bye.